Dr. Alicia Thompson stood in the parking lot of Metropolitan General Hospital in Detroit, looking at the sprawling medical complex that was now her responsibility. At 38, she'd just been appointed hospital director, one of the youngest and one of the few black women to lead a major urban hospital in the Midwest. Alicia had earned her position through 15 years of healthcare administration experience. She'd completed her medical degree at Johns Hopkins, practiced emergency medicine for 5 years, then transitioned into healthcare management. She'd served as assistant director at 2 hospitals before Metropolitan General's board recruited her specifically to address the institution's declining performance metrics and concerning equity issues. Metropolitan General was a 280-bed hospital serving Detroit's predominantly black East Side. Despite serving a majority-minority community, the hospital's leadership and senior medical staff were predominantly white. Patient satisfaction scores were troublingly low, particularly among black patients who reported feeling dismissed or receiving inferior care compared to white patients. The hospital's board had hired Alicia with a clear mandate: improve patient outcomes, address equity disparities, and restore community trust. They'd given her authority to make necessary changes, including restructuring departments and replacing staff who couldn't meet new standards. Today was Alicia's official first day, though she'd spent the previous 2 weeks in orientation and strategy meetings with the outgoing director. Her plan was to start by observing operations across different departments, talking with frontline staff, and understanding how the hospital actually functioned versus how policies suggested it should function. She'd deliberately dressed casually for her first day of observation: comfortable pants, a simple blouse, and flats suitable for walking the hospital's corridors. She carried a leather portfolio containing her orientation materials and initial observations. She wasn't wearing her white coat or hospital ID badge yet, planning to collect those from Human Resources later that morning. At 7:45 a.m., Alicia entered Metropolitan General through the main entrance. The lobby was quiet at this early hour. She walked past registration toward the emergency department, intending to observe morning operations during what was typically a busy time for emergency services. The emergency department at Metropolitan General was chronically overcrowded and understaffed. Patient wait times averaged 4 hours for non-critical cases. Complaints about rude staff and inadequate care were frequent. Alicia knew the ER needed significant attention and improvement. She entered the ER through automatic doors and paused to orient herself. The department was arranged in the typical layout: nurses' station in the center, patient bays radiating outward separated by curtains, trauma rooms for critical cases along one wall. About 15 patients were visible in various stages of treatment or waiting. The noise level was high, with monitor alarms, staff conversations, and patient complaints creating constant background sound. Alicia approached the central nurses' station where 3 nurses were working. 2 were younger women, focused on computers and charting. The third was an older white woman with supervisor credentials on her badge. Her name tag identified her as Janet Holbrook, RN, nurse supervisor. "Excuse me, I'm wondering if I could ask a few questions about patient flow and triage procedures." Janet looked up from her paperwork with immediate irritation at being interrupted. She took in Alicia's appearance and her expression shifted to dismissive hostility. "Are you a patient? If you need medical attention, you need to register at the front desk." "I'm not a patient. I'm here to observe operations and understand how the emergency department manages patient volume." Janet's irritation increased. "This is a working medical facility, not a tour site. We don't allow observers without prior authorization, liability insurance, and supervision. I understand the concerns about unauthorized observers. I'm not unauthorized. I'm part of hospital administration conducting operational assessment." "Hospital administration?" Janet's tone dripped with skepticism. "You're not wearing ID, you're not in professional attire, and I've never seen you before. I don't believe you're with administration." One of the younger nurses glanced up with recognition, as if she knew who Alicia was, but said nothing when Janet shot her a warning look. Alicia remained calm. "My name is Dr. Alicia Thompson. I'm the new hospital director. Today is my first day, and I'm observing departmental operations as part of my transition into the role." Janet's expression didn't soften. If anything, she became more hostile. "The hospital director is a white man named Richard Brennan, who's been here for 12 years. I don't know what game you're playing, but you need to leave this department immediately. Richard Brennan retired 2 weeks ago. I was hired to replace him. If you'd like to verify that, you can contact Human Resources or check the hospital's internal communications about leadership transition." I'm not verifying anything. I'm telling you to leave. This is a medical emergency department. We have patients to care for. We don't have time for people wandering in making up stories about being hospital administration. Alicia pulled out her phone to show the appointment letter from the hospital board, but Janet waved it away without looking. Anyone can fake documents. You're not wearing proper identification. You're not dressed professionally. You look like someone off the street who wandered in here. Security will escort you out if you don't leave voluntarily. The younger nurse who'd shown recognition earlier spoke quietly. Janet, I think she might actually be the new director. There was an email last week about Dr. Thompson starting today. Elena, mind your own business. Get back to your charting. Alicia addressed Elena directly. Thank you for recognizing the communication about my appointment. I appreciate you speaking up. Janet stepped out from behind the nurse's station, positioning herself between Alicia and the rest of the department. I don't care what emails were sent. I'm the nurse supervisor of this emergency department. I have authority over who's allowed in this space, and I'm telling you that you're not authorized. Leave now, or I'm calling security. Other nurses and a doctor had stopped working to watch the confrontation. Several looked uncomfortable. The doctor, a white man in his 40s, approached. Is there a problem here, Janet? This woman is claiming to be the new hospital director, but she's not wearing ID and she's dressed inappropriately. I'm asking her to leave. The doctor looked at Alicia with uncertainty. Are you Dr. Thompson? Yes, I'm the newly appointed hospital director. Today is my first day, and I was observing emergency department operations. She's lying, Janet interjected. Hospital directors don't show up on their first day dressed like that without proper credentials. The doctor pulled out his phone and appeared to check something. Janet, there was an email about Dr. Thompson starting today. I think she's telling the truth. I don't care what email you think you saw. She doesn't have ID. She could be anyone. I'm not taking security risks in my department. Alicia had seen enough. Janet's aggressive refusal to accept her identity despite multiple confirmations, her dismissive tone, and her decision to threaten security removal rather than take 30 seconds to verify Alicia's credentials revealed exactly the kind of poor judgment and customer service problems that plagued Metropolitan General. Nurse Holbrook, I understand security concerns and the importance of verifying credentials. What I don't understand is your aggressive hostility and refusal to use simple verification methods available to you. A phone call to Human Resources would confirm my identity immediately. Instead, you've chosen to be dismissive, rude, and threatening. That approach to anyone entering this department, whether they're a new hospital director or a patient's family member, is unacceptable. Janet's face reddened. Don't lecture me about how to run my department. I've been a nurse here for 23 years. I know how to maintain security and standards. You've been a nurse here for 23 years, which means you've had 23 years to learn professional communication and basic verification procedures. Yet you've demonstrated neither. I'll be discussing this interaction with Human Resources and your department head. Are you threatening my job? I'm informing you that your conduct this morning will be reviewed. Now I'm going to Human Resources to collect my identification and complete onboarding. When I return to this department later today for a formal operational review, I expect professional behavior from all staff. Alicia left the emergency department and walked to Human Resources. She documented the entire interaction in detail while it was fresh, noting Janet's refusal to verify identity, her aggressive demands for removal, and her hostility even after other staff confirmed Alicia's position. In Human Resources, she completed her onboarding paperwork, received her hospital ID badge and credentials, and changed into her white coat with Dr. Alicia Thompson, hospital director, embroidered on it. Then she called an emergency meeting with the chief medical officer, the chief nursing officer, and the director of Human Resources. She recounted her experience in the emergency department in detail. The chief nursing officer, Patricia Williams, was horrified. Dr. Thompson, I apologize. Janet Holbrook's behavior was completely inappropriate. She should have verified your identity, rather than threatening to have you removed. The issue isn't just that she didn't recognize me specifically. The issue is how she treats anyone she perceives as not belonging in her department. If that's how she responds to the hospital director, how does she treat patients' family members? How does she treat patients themselves when she decides they don't meet her standards for how people should look or behave? Alicia pulled out her phone and showed them Janet's personnel file, which she'd requested from HR during orientation the previous week as part of reviewing key staff across departments. Janet Holbrook has 17 documented complaints over the past 8 years. Complaints from patients about dismissive treatment, complaints from family members about rudeness, complaints from junior staff about hostile work environment. Every complaint was investigated minimally and dismissed because Janet claimed she was maintaining professional standards and security protocols. What I experienced this morning is a pattern, not an isolated incident. The HR director reviewed the file with growing concern. These complaints should have triggered more serious review and potential disciplinary action. They should have, but they didn't, which suggests systematic failure in accountability. Janet's been allowed to treat people poorly for years because her seniority and her framing of hostility as professional standards protected her from consequences. Dr. Raymond Foster, the chief medical officer, spoke carefully. Dr. Thompson, how would you like us to proceed? I want Janet Holbrook suspended immediately, pending a full investigation of her conduct and the complaints in her file. If the investigation confirms a pattern of unprofessional behavior, I want her employment terminated. We cannot have staff in patient-facing roles who treat people with hostility and refuse basic professional courtesy. Patricia, the chief nursing officer, looked troubled. Janet's been here over 2 decades. Termination will face resistance from some staff who see her as a dedicated long-term employee. Longevity doesn't excuse hostility, and dedicated employees don't accumulate 17 complaints about mistreating patients and colleagues. Janet's employment status should have been reviewed seriously years ago. The fact that it wasn't is a failure we're correcting now. The meeting concluded with agreement to suspend Janet immediately and conduct a comprehensive investigation. Within 2 hours, Janet Holbrook was called into a meeting with Patricia and HR, informed of her suspension, and escorted from the building. The reaction among emergency department staff was mixed. Some nurses expressed shock that Janet had been suspended so quickly. Others, particularly younger staff and staff of color, expressed quiet relief. One black nurse told Patricia confidentially that Janet had made her work environment hostile for years with subtle racist comments and dismissive treatment, but she'd been afraid to file formal complaints because Janet was so powerful in the department. Over the next 2 weeks, the investigation uncovered troubling patterns in Janet's behavior. Multiple former patients who'd filed complaints agreed to be interviewed. Their accounts described a nurse supervisor who was cold, dismissive, and particularly hostile toward black patients and their families. Several described being told they were exaggerating symptoms, being made to wait longer than necessary, or being spoken to rudely when they asked questions about their care. Staff interviews revealed that Janet had created a culture in the emergency department where nurses felt pressured to prioritize certain patients over others, based on Janet's assessment of who deserved attention. Several nurses described Janet making comments about frequent flyer patients, drug-seeking patients, or people she believed were abusing emergency services. Her characterizations of these problem patients skewed heavily toward black patients and low-income patients. The evidence was overwhelming. Janet had spent 23 years in a position of authority, using that authority to provide differential care based on her personal biases about who deserved quality treatment. Metropolitan General's legal counsel reviewed the findings and confirmed that Janet's conduct violated hospital policies on patient care, non-discrimination, and professional behavior. Her employment was terminated 3 weeks after the incident with Alicia. Janet hired an attorney and threatened wrongful termination litigation, claiming she was being scapegoated because she'd challenged someone who wasn't properly credentialed. Her attorney's letter argued that her security concerns about an unidentified person in the ER were legitimate, and that termination was retaliation for her doing her job. Metropolitan General's response was thorough and unforgiving. They provided Janet's attorney with documentation of 17 complaints spanning 8 years, testimony from multiple patients and staff describing discriminatory treatment, and evidence that Janet's hostility toward Alicia fit a documented pattern of bias rather than legitimate security concerns. Janet's attorney reviewed the evidence and advised her that litigation was unwinnable. She dropped the wrongful termination claim and left the healthcare field. Meanwhile, Alicia moved forward with broader changes at Metropolitan General. The emergency department underwent complete restructuring, with new leadership committed to equitable patient care. Staff received mandatory training on implicit bias, cultural competence, and professional communication. Patient satisfaction surveys were redesigned to specifically assess whether patients felt treated with respect and whether they perceived any discrimination. Within 6 months, emergency department patient satisfaction scores had improved by 32 points. Complaints about staff rudeness dropped by 78%. Wait times decreased as staff worked more efficiently in a less hostile environment. The changes demonstrated that Janet's removal hadn't just addressed one problematic employee, but had allowed the entire department to function better. Alicia also implemented hospital-wide changes, addressing the equity issues she'd been hired to fix.
She diversified leadership, created pathways for advancement for nurses and staff of color, and established clear accountability for discriminatory behavior at any level of the organization. 3 years after her first day at Metropolitan General, Alicia was invited to speak at a healthcare administration conference about transforming hospital culture and addressing discrimination in medical settings. She shared her story about Janet Holbrook without using names. On my first day as hospital director, I walked into the emergency department to observe operations. A nurse supervisor saw a black woman in casual clothes and decided I was someone who needed to be removed from her department. She refused to verify my identity, despite multiple people confirming it. She threatened to call security. She was hostile, dismissive, and completely unprofessional. I had the authority and position to hold her accountable immediately, but most people who experience that kind of treatment in healthcare settings don't have that authority. They're patients or family members who get dismissed, treated rudely, or provided inferior care, and they have limited recourse. Alicia continued. That nurse supervisor had accumulated 17 complaints over 8 years describing the exact behavior I experienced, but she'd never faced real consequences because her seniority and her ability to frame hostility as professional standards protected her. She'd spent 23 years in a patient-facing role, treating people poorly, particularly black patients, and the institution had failed to stop her. When we removed her and restructured the department, patient satisfaction improved dramatically, staff morale improved, care quality improved. One person's bias and hostility had been poisoning an entire department, and removing that poison allowed everyone else to thrive. The speech resonated throughout healthcare administration. Several hospital systems contacted Alicia to consult on addressing discrimination and improving equity in their institutions. She became a national voice on healthcare equity and was promoted to regional director overseeing 6 hospitals. 5 years after the incident, Janet Holbrook had left healthcare entirely and was working in retail management. She'd struggled to find nursing work after being terminated from Metropolitan General for cause. The termination and the reasons for it followed her professional reputation. In an interview with a nursing ethics publication years later, Janet offered reflection that seemed genuine but incomplete. I thought Dr. Thompson was someone who didn't belong in the emergency department because she wasn't dressed like I expected a hospital director to dress, and she didn't look like I expected a hospital director to look. Looking back, I see that my expectations were shaped by biases about who holds authority in healthcare. I expected someone white and male. When I saw a young black woman, I assumed she was lying about her position. I lost my career because I couldn't see past my assumptions. But the bigger issue is how many patients I mistreated over the years with those same assumptions. How many black patients did I dismiss as drug-seeking or exaggerating pain? How many poor patients did I treat as less deserving of care than wealthier patients? I spent 23 years in nursing telling myself I was maintaining professional standards when I was really just enforcing my own biases about who deserved quality care. 10 years after Alicia's first day at Metropolitan General, the hospital had been transformed. Patient outcomes had improved across all demographics. The equity gaps that had existed when Alicia arrived had been substantially reduced. The hospital had become a model for addressing discrimination and providing equitable care, featured in healthcare journals and used as a case study in medical and nursing schools. Alicia remained proud of the transformation but remained clear-eyed about what it had required. We changed Metropolitan General by removing people who practiced discrimination and couldn't or wouldn't change, by creating accountability systems that identified and addressed bias, and by elevating leaders committed to equity. That transformation wasn't easy or comfortable. People who'd been allowed to practice discrimination for decades had to be removed from positions of authority. Staff who were comfortable with the old culture had to adapt or leave. Janet Holbrook was just one example. She was the nurse supervisor who tried to have me removed on my first day, but she represented a broader cultural problem. Removing her was necessary but not sufficient. We had to change systems, training, accountability, and leadership across the institution. The lesson for healthcare leaders is that discrimination isn't just wrong ethically, it's destructive operationally. Janet's hostility and bias poisoned her department for years, driving away good staff, mistreating patients, and creating an environment where quality care was impossible. When we addressed her behavior and the culture that protected it, everything improved. The story of Janet Holbrook became a cautionary tale in healthcare, the nurse supervisor who tried to remove her new boss on the boss's first day, revealing years of discriminatory behavior that had been ignored. It was taught in nursing programs as an example of how bias could destroy careers, and in healthcare administration programs as a case study in the importance of accountability and equity. And at Metropolitan General Hospital in Detroit, where Alicia Thompson had been dismissed and threatened with security removal on her first day, the transformation she'd led ensured that no patient or visitor would experience that kind of hostility from staff whose job was to provide care and comfort. Janet Holbrook had seen a black woman and decided she didn't belong in the emergency department. That woman was the new hospital director with authority to transform the institution. Janet's inability to see past her racial biases cost her a 23-year career and exposed the systemic problems that had allowed discrimination to flourish for years. That was the price of discrimination in healthcare. Not just individual career destruction, but institutional accountability that ensured quality care required equitable treatment of all patients regardless of race, class, or appearance.
Thank you very much for listening. Please let us know what you think of this story in the comments. Don't forget to like the video and subscribe to the channel. Turn on notifications so you don't miss any other videos.